Thank you for your interest in participating in the PREVENT Preterm Birth study. We hope to enroll 10,000 women in our hospital system to test whether or not the use of this preterm blood test will help us to prevent preterm birth. You have been asked to join the study because you're healthy, over the age of 18, and have no active signs or symptoms of preterm labor, and you're currently pregnant with a single baby. Women who have previously taken progesterone after 13 weeks gestation, or those who have a previous history of spontaneous preterm birth less than 37 weeks, anyone who's had a blood transfusion during this pregnancy, or are pregnant with more than one baby, such as twins or triplets, or are planning to have a C-section or induction of labor before 37 weeks may not participate in the study. In addition, women who are found to have a short cervix on ultrasound, or who have an allergic reaction to aspirin, progesterone, or peanuts may not participate. Your participation in this study is completely voluntary. The preterm blood test is available commercially, and you may choose to have the test drawn on your own, but this would not be part of the current study. If you choose not to participate, or if you choose to withdraw at any time, you will not lose any benefits or rights to which you're entitled, and this decision will have no impact on the health care you receive. If you choose to participate, we'll ask you to sign a written consent form indicating your willingness to participate. When you've signed the consent, you'll be asked several questions about your general health. Between 19 weeks and 6 days and 20 weeks and 6 days during this pregnancy, around the time of your ultrasound, you'll have a blood draw. We'll collect 2 tubes of whole blood. That's about 17 mLs or 3½ teaspoons of blood. Your blood will be drawn by someone with experience performing these types of laboratory tests, and after your blood draw, you will randomly be assigned to the screening group or no screening group. If you're assigned to the no screening group, you'll be notified at the time of your blood draw, and you'll receive a $20 gift card to compensate you for your time and effort. You'll receive the standard obstetric care from your regular prenatal provider. At the time of your delivery, information about your delivery and the outcomes of your pregnancy will be collected from your medical record. At the completion of this study, your blood sample will be used to test the preterm blood test to validate its ability to predict the outcomes of the pregnancy. In addition, the remaining samples of your blood will be stored for future analysis to identify other markers of obstetric complications. If you're assigned to the screening group, you'll be notified at the time of your blood draw, and within 7 to 14 days, you'll receive the results of your preterm blood test. The preterm test has a commercial value of $500, but you will not be charged for this test as part of your participation in this study. We'll contact you by telephone and in writing, and we will provide the results of your test to your obstetric provider. If you're found to have a low risk of preterm birth, you will continue your usual prenatal care from your regular prenatal provider. However, if you're found to be at increased risk of preterm birth, you'll be invited to participate in the Prematurity Prevention Clinic, and you'll be offered various interventions that have been shown to reduce the rate of preterm birth in other groups of women who are at increased risk. You'll be assigned to a testing group by chance. Your risk of preterm birth is not expected to increase or decrease depending on which group you're assigned to. If you're assigned to the no screening group, you'll be treated just as you normally would by your provider. If you're assigned to the screening group, the risks of early delivery will be assessed using the preterm blood test. Not everyone who has an elevated risk of preterm birth based on the preterm blood test will have a preterm delivery. However, everyone who's found to be at high risk will be offered potential interventions. The risk of blood draws is small, but includes bruising, bleeding, and pain or infection at the site of the blood draw. To minimize these risks, someone that is certified to draw blood will perform your blood draw. Another possible risk of participating in this study is that your name and personal information may be seen by persons who are not part of this project. We will do everything we can to protect your personal information. You'll be given an identification number that will be used in place of your name on all study documents. There may be no direct benefits to you or your baby from participating in this study. However, your participation may provide important information that can be used in future to prevent babies from being born too soon. If you're part of the screening group, it's possible that early identification of risk of preterm birth and the planned interventions that may prevent preterm birth or prolong your pregnancy could result in a better outcome for you and your baby. Intermountain Healthcare is conducting this study, and the researchers do not receive any extra payment for conducting the study. You will not be charged for the preterm test nor for your participation in the Prematurity Prevention Clinic if you're found to be at high risk of preterm birth. If you join the study, you can decide to stop at any time, and if you decide to leave the study, you'll still receive the same care that you would have received for your pregnancy without being in the study. Your study doctor can also stop you from taking part in this study at any time if he or she believes it's in your best interest to stop, or if the study is stopped. Please tell the research staff if you're thinking about stopping so that we can discuss any follow-up care or testing that could be important to you. If you become injured while taking part in this study, Intermountain Healthcare can provide medical treatment. We will bill you or your insurance company in the usual way. Because this is a research study, some insurance plans may not pay for your treatment. If you believe you've been injured as a result of being in this study, please call the principal investigator right away. You may also call the Office of Research at 1-800-321-2107. As the study progresses, the study doctor will talk to you about any new information or developments that may increase your risk. At that time, you can decide whether to continue with the study or not. A separate group of doctors who are not participating in this study will review the results frequently and notify the research team if there are any concerns about safety. You can ask us to stop collecting your information, though we will still be able to use the information we've already collected from you. If you have questions about this study or a project-related injury, you can contact Dr. Ware Branch or our research staff at the hospital where you enrolled during business hours. Dr. Branch can be reached after business hours at 801-507-7400. Preterm birth is a major problem, and we need a new approach to reduce this devastating complication. Use of a new blood test like the preterm test may provide a better way to identify the women at highest risk of preterm birth early enough in their pregnancy to prevent it. This important study will provide critical information that may change the way we care for pregnant women and their unborn babies. We're excited to offer you an opportunity to help with this important research. Together, we can make a difference.